Okay, good evening. I'd like to welcome everybody to our lecture tonight. My name is Dr. Derek Yonai, and I'm the Lundy Scholar of Business Philosophy at Campbell University. Tonight's lecture is made possible through the generous support of the Intercollegiate Studies Institute, the School of Pharmacy at Campbell University, and the Lundy Chair of Business Philosophy. The Politics, Law, and Economics lecture series is designed to highlight the three institutions which must work in concert to support and defend a free civil society. Those institutions are good governance, the rule of law, and market-based institutions. If one of those elements is missing, civil society will collapse into tyranny. This term, we have been focusing on applications of public choice. Public choice economics, simply put, is the use of economic methodology to political science. And our speaker tonight will continue on with that theme. Our speaker is Dr. Alexander Tabarrok from George Mason University. He is an associate professor of economics at GMU, and he is also the research director at the Independent Institute. Professor Tabarrok's research interests focus primarily with law and economics. He studies issues touching on race and poverty with regards to judicial decisions and awards. He also has examined whether states that employ elected judges versus those that use appointed judges differ with regards to tort payouts. And he has also examined how bounty hunters compare with police in arresting fugitives. His other research topics that he examines range from patent system reform and increasing the supply of human organs for transplants to the regulation of pharmaceuticals. Dr. Tabarrok is the co-author of the website www.fdareview.org, which is an extensive resource on the history of the FDA, its policies, and potential reform of the FDA. He is also the editor of various books, such as Entrepreneurial Economics, Bright Ideas from the Dismal Science, The Voluntary City, Choice, Community, and Civil Society, and Changing the Guard, Private Prisons and the Control of Crime. His academic papers have been published in the Journal of Law and Economics, the American Law and Economics Review, the Journal of Theoretical Politics, and CLECOS. He is also published in mainstream media and regularly writes for the blog Marginal Revolution. So please join me in welcoming our speaker this evening, Dr. Alex Tabarrok.
Great, thank you very much, Derek. It's certainly a pleasure to be here. I want to begin by talking about an example of the FDA in practice. It's only one example, but I think that this is going to encapsulate a number of important lessons. This is a sensor pad. It's a very simple device. It's basically two sheets of plastic with a lubricant in between. And the idea of the device is simply to improve the sense of touch. It was designed to help a woman detect a breast cancer lump. Okay? Very, very simple device. I want you to take a look at that. I don't know, Adam, if you can get a close-up of that for the people in the other campus. Okay? Totally simple device. I'm going to let you take a look at it, hand it around and take a look at it. And when you do so, I want you to ask yourself, do you think this device could be effective? Do you think it's a safe device? Would you allow this device to be marketed in the United States? And when you're thinking about all of these questions, how long would it take you to decide on this question? Let's see. Oh, okay, there we go. All right. The sensor pad was invented in 1986 and submitted to the FDA for approval. Let me tell you what happened elsewhere in the world. In Canada, the sensor pad was approved within 30 days with 6 pages of documentation. It was approved for sale in Japan. It was approved for sale in Western Europe. It was not approved in the United States. The FDA decided that this device, they couldn't find any other device, any previously approved device which was like this device. So going on the theory that anything which was new must be unsafe, they classified the sensor pad as a high-risk device. Because it was a high-risk device, they said, well, it's got to go through some additional testing, some additional trials for this high-risk device. Nothing else like it. It's got to be tested. And there began a rather remarkable saga. At first, the manufacturers of the sensor pad were compliant with the FDA's request. And they ran some clinical trials showing that indeed the sensor pad improved the sense of touch and potentially could help women to find a breast lump more easily, a smaller breast lump. The FDA, however, was not satisfied. The FDA said, no. In order to get this device approved, you're going to have to show that it reduces the mortality rate from breast cancer. Okay? In other words, they told the manufacturer, you're going to have to do a clinical trial in which you get several thousand women, you split them up into two groups randomly, you give one group the sensor pad, one group without. You're then going to have to follow them for years until enough of them die of breast cancer so that you can compare the mortality rates in the two groups and decide whether the sensor pad has actually reduced the mortality rate. Well, the manufacturers of the sensor pad knew that this was the death knell for the product. Okay? Clinical trials, as everyone here is well aware, are extremely expensive. And even if the company were to do these clinical trials, and many years later, after following these women, even if they were to do the clinical trials and were to turn out to be successful, and they were able to sell the product, they would never make enough money. You can't sell this product for enough money to justify the clinical trials that it would take. So they knew this was the death knell for their product. And for most products, for most companies, that would have been the end of the story. They would have given up, gone back to producing something else, dealing with another regulatory agency instead of the FDA. But the manufacturers of the sensor pad were a little bit more gutsy. And they decided to start selling the sensor pad anyway, even without FDA approval. Very unusual. So they started selling the sensor pad and giving it away to doctors and hospitals, okay, and women throughout the United States. And indeed, many hospitals started to adopt this product and give it away to women. Right? Well, the FDA was not having any of this. And in 1989, on behalf, I quote, on behalf of American women, the FDA, with armed police, raided the manufacturer of the sensor pad and hospitals and clinics which had been giving away the sensor pad. They confiscated all of the sensor pads, okay, on behalf of American women. Well, the sensor pad case then went to the courts, where it dragged on for many years. Finally, things began to change in 1994 when the Wall Street Journal, and then a little bit later, 2020, did a story on the sensor pad. Okay? And the story was picked up in Congress, and hearings were held. And at these hearings, a number of doctors testified in favor of the sensor pad, as did some women who argued that had it not been for the sensor pad, the sensor pad may have saved their lives. They argued that the sensor pad saved their lives. So these women testifying in Congress on behalf of this product.